Hey everyone, welcome back to our rotator cuff series. This is part 3, and in this video we're going to take a look at how we repair the rotator cuff using suture anchors. When we repair a rotator cuff tear, we typically use an implant called a suture anchor. And traditionally, these types of anchors actually screw into the bone where it's held in place, and there are stitches or sutures that are incorporated into this implant that are then passed through the rotator cuff tissue, which is then repaired back into position and held in that position during the healing process. All right, guys, so I've got a few things here to help demonstrate how we repair rotator cuff tears. And to start things off, I'm going to show you guys the model one more time. Check out my other videos on rotator cuff anatomy just to sort of understand what we're talking about here with these rotator cuff tendons. But here's the model. Here's looking straight at the shoulder. And I'm going to use this instrument here just to point things out. And these are tendons of the rotator cuff coming across here. Subscapularis, supraspinatus, infraspinatus, and teres minor back that way. And when we have a rotator cuff tear, we have a detachment of the tendon from bone. So here's the humeral head, and then there's the socket. And so when those rotator cuffs are attached, they're attached around the humerus like this. But when we have a tear, that rotator cuff is torn from the bone like this. And so keep that in mind when we're demonstrating this repair. To better demonstrate the repair, for this video, we're going to have a couple models that we actually utilize in our training to practice knot tying and these repair techniques. And so these models here will help demonstrate that. And so just imagine that this flap of tissue is the tendon tearing from bone, and that this is the actual bone of the arm that the rotator cuff would need to be reattached to. So that would be a torn situation and then repair back down like that. All right, so let's take a look at what an actual rotator cuff anchor looks like for repair. So I've got a couple of these right here. These are some that I actually use in surgery. And these are made by different companies. And this is a threaded anchor. And I'll bring this a little bit closer. We'll try to focus in a little bit here. And so this is the anchor. And you can see how there's threads in it. And you just twist it like that, and that will thread into bone just like a screw. Attached to that are these sutures or stitches. And these are incorporated into the anchor right here. And if we deploy it, so I'll pull this out like this, and you can see how that sits on the anchor like that, and it really just sort of screws in like a regular screw. And so we pull that out, and if you'll notice, I'll zoom in a little bit. So if you notice that that these sutures are loaded inside of the anchor like this. And I'll go ahead and pull this out the rest of the way out of the anchor, out of the handle. So that'll come all the way out like that. And so this is what the handle looks like without the anchor. You see, so we hold this end in surgery and we twist it into the bone like that. And here's the actual anchor. And so you can see we've got 3 sets of sutures. Different anchors have different types of sutures, and some have maybe 1 set, 2 sets, but this has 3 sets of sutures, and they're different colors that let us tell the difference between the different limbs during the procedure. And so in this particular anchor, we've got a blue limb, we've got a striped set of striped sutures, and then we have a set of solid white sutures. And these, again, you can kind of see how these go down deep into the anchor right there. And then they are secured on the anchor like that. And one of the special ways that these anchors are designed is to allow the stitch to actually slide through the anchor. And this allows us to tie a special knot, which lets us do this arthroscopically or minimally invasively through very small incisions. So if I'll actually use the striped one because it'll show the suture sliding a little bit better. So let me get these out the way. And here we go. Okay, so looking at the striped suture, if you notice if I pull, you'll see as I pull out, we're sliding the stitch. And we tie special knots at first called sliding knots that allow us to tie these special knots down to repair the rotator cuff. And I'll demonstrate that in just a second. But that's in general how the anchor looks itself. When we thread it into the bone, we thread it all the way down so that the anchor is all the way buried, all the way up to this area right there. And these are pretty strong. Okay, so let's actually deploy an anchor into our model here to demonstrate what an actual repair would look like. And so this tends to slide on the table, so I'll do my best to hold it still. But we have to prepare the bone to receive the anchor. And so what I'll do right here is take my awl. This is just a sharp metal awl, and this creates the pilot hole for the anchor to thread into. And we'll pick a spot right here on bone. We'll pick it about right there. And then I've got a mallet, and we'll just tap this into bone like this. And so I'll try my best to hold this in place. So we'll tap this in. Here we go here. So you can kind of see how that's starting to go in just like that. And so we'll tap this into bone. I don't have to hold it and obscure your view for just a second. So we tap that in. Usually you don't have to tap it quite that hard, but so you can see we're getting right down to that first line. So for this particular system, we want to be down on that first line. Okay, so we're definitely to that line, and then we will remove the awl. And what you can see is it makes a nice pilot hole in the bone right there. And this is where we will thread in our first anchor. And so we'll take a fresh anchor, just like we showed a little bit earlier. It has all the threads on it. And then we situate the anchor like this on the bone. I'll turn it this way so you can see. And then we just simply start screwing the anchor in. Now, in some cases, in different quality bone, we might have to prepare the socket a little bit differently with what's called a tap to make its own threads into the socket itself, but usually we can just go straight in with the anchor like this. And so we screw right on in like that, and I'll show you that anchor is going in just like so, and so we just screw it on in. And I can tell there's some resistance there, and that's good. That's going to give us a really solid anchor. Like that. And so you can see we're pretty much flush to the bone. We'll stop just like that. Okay, so here's a little bit closer look. So that anchor's way buried into the bone, which is what we want. And then what we need to do next is we take our sutures off the cleat. So those are ready. And then we just have to pop the anchor off. And so there's a little resistance here, but that comes right on off like that. And you can see that comes off like so. All right, so now we have our suture anchor deployed in bone. And so that's real strong. I can pull on that, and that's not going anywhere. And so now we have our stitches in our anchor, secured in the bone, and these are ready to be placed through the rotator cuff tear and tied down. All right, we're going to take a moment to show how we actually tie these knots on some of these anchors. You can do knots that you actually tie yourself, or there's different systems where you don't even have to tie a knot, and we call that a knotless repair. And I will show you what that looks like as well. But to better get a sense of how we tie some of these sliding knots that we do in a knotted technique, I will keep one of our stitches around just this handle right here, and that will allow it to slide easily, demonstrating how that works. And so we start off with what we call a sliding knot. And there's lots of different kinds, but I use one called an SMC knot. And so what we do is we just get the stitch in our hand. Now pretend that this is actually on our anchor, like the anchor I showed you guys a little while ago. So just pretend it's still on the anchor here. And we'll go ahead and tie the sliding knot. So we do a little flip over like this. Slide that through, and then we do another one like that. That slides through like so. And then one more pass, we go through here. And this just takes practice. There's lots of different kinds. And then as we slide that, that will create this special knot like this. Okay, so here I'll zoom in a little bit for you. So that's that special sliding knot like that. And so I'll slide it back a little bit so we can really get a good look at how this slides. All right, and then I'll zoom out. Okay, so there's our sliding knot ready to go. And to push this down into the shoulder through a small incision, we use we have what's called a knot pusher, which is just a little device that threads on like that. There's a little ring for my thumb to push on it. And all we really need to do is just pull back. And then you see how that slides right down, and then it stops. And then what we'll do is we'll slide our knot pusher down. And now I'll zoom in some. And so now I can pull back a little bit. I can actually pull I don't want to pull my drawer out. And so we can push this knot right on down like that. And you can see how that starts to snug really good. And so then I can pull on one side, and that's really holding it down. And then we just go a little bit past, and I'll grab this other end. And then this will tighten just like that. And then you can see that is, I can actually pull my drawer out with this knot now. And so that knot's really secured down. And so that's pretty much how a sliding knot works. And so let me zoom out. And then we just pass a few more throws like this. So we just put some more throws, and then you can see now we can push the knot with our knot pusher down like that. And then we tighten it up like that. Now this is a metal handle, so the suture will slide around on it, but you'll get the idea here in a second. And then we pass it through again, and then we just start doing different passes through, just like that. And then here I'll zoom in one more time. And then we do it again, like this. And then we can push that on down like so. You can see that leaves a very nice secure knot. And then you can, usually we do a few more throws, like 3 throws after the sliding component. And that's how that works. So that's a sliding knot right there for you demonstrated. So let's do it on the model now. All right, so to pass our stitches through the rotator cuff tissue, I've got a couple devices here. These devices are used to pass the stitch through the rotator cuff tissue. So this first device that I have, it's on this pink handle here, and it has a sharp end here, and really if you deploy it, it sends out this small hook that we use to grab the suture. And so that's one device that I use commonly. And then we've got this other device here. It's got a handle. It's got this long needle that threads through here all the way to the end. and this will grab the suture for us. And so what we do, this little handle here squeezes this, and then you can see that will, by squeezing that, you close down the jaws on that end. And so when we grab the whole thing and we squeeze it together, you can see how the needle gets sent up this way, and this is what will pass the stitch through the rotator cuff tissue. So you just grab it and then squeeze it in like that. And so here's a little bit closer look how that works. Grab the stitch, or grab the tissue, and then you push up, and then that needle goes up like that. And that little groove on the end of the needle is what grabs the suture. One more time, just like that. All right, so we'll try that with the actual stitch. And so here I've just got a stripe stitch here. We will take our grasper, and then we just load it into that groove like that, and that clicks in, and then we go in and grab our tissue. So pretend we're going in and grabbing our stitch, or sorry, grabbing our tissue, the rotator cuff tendon. We grab it, and then we squeeze, and then that will, that needle will push that stitch up just like that. And then as we let go, the needle retracts, and then that trap door will shut, just like, I'll do it a little bit more slowly, just like that. And then that grabs the stitch, and then now we've got a good hold of it, and we can pull that out of the shoulder to tie. Okay, so now let's pass some stitches through the tendon and show you guys how that works. So here's all of our stitches here, just like that. And we will go in, I will zoom in a little bit for y'all. And so we go in and we find the best spot for the suture. And so we, obviously we're not grabbing this with our fingers because we're doing it through small poke holes. And so we go through the tissue like that. And so you can see how that works. And then as we go through the tissue, we will deploy our hook, and that will go in just like that. And then we just go and grab our suture. Let's see if I can get it to go. There it goes. I want to make it look nice and smooth. There. Whoop. So go in and grab the stitch just like that. Okay, so that's got it. So you can see how my device has grabbed the stitch, and then we can pull it out the rotator cuff like that. And so now we've passed our stitch. We shuttle the rest of the suture through the rotator cuff like so. And then now we've got a repair stitch just like that. And so then we can tie. So we'll grab our other blue stitch, our matching stitch. And we will tie one of our sliding knots that I showed you a little bit earlier. And so that's what this will look like. So bear with me while we try to do this on a moving model. And so we'll tie our sliding knot just like before. Okay. And we go one more pass through this little loop here. All right, and so we cinch all this up, and we should have a nice sliding knot like so. Just like that. So there's there's our sliding knot right there. So now we can pull that down. So this is all going through, like I've said before, this is minimally invasive surgery. This is all going through small poke holes in the shoulder. And we can slide this knot down now. So you can see I'll pull it like this. And so I can pull this knot, and that will slide down and cinch the rotator cuff down just like that. And then in order to really get it snug, we'll take our knot pusher, and we thread our stitch through the knot pusher like that. And then we can push that down through those small poke holes in the shoulder, and then we can further secure the knot just like that. We just really push it down nice and snugged. And then just like if you're tying your shoes, you're going to pull on both the laces and tie it just like that. And then we typically will throw a few other loops through it. We can do this one-handed if we want to be fancy, just like that. And then this knot pusher will allow us to slide that knot down like that. And then we do it just like so. Here, I'll show you a little bit bigger throw so you can see how my knot pusher pushes the subsequent throws down to the actual tissue. So that's what that'll look like. And so there's our knot, our throw, and then we can push that down just like that. There we go. And then we can take the knot pusher off, and then if we come in right to that, you can really see how that really snugs it down really well with a lot of security. If I get my grasper here, I can show you that's not going anywhere. And then we just pass stitches through, for example, over here, and then we just secure the whole tendon like that. All right, so let me show you how we can pass the suture with our Scorpion device through the rotator cuff. And so we've already tied this one using or passing the stitch with the other device, but now we will pass the suture using our Scorpion self-retrieving device. So we're going to plan on using the striped stitch, and so we would go into the shoulder and we would grab the stitch out, and then we would deploy it onto the Scorpion here. And so you can see there's our groove on the Scorpion, and we just pop that stitch in there like that. It's ready to go, so we can close it. That goes into the shoulder like that through the small, minimally invasive portal hole or incision on the skin. And then we come in and we go right up under the tendon tissue like this, and then we can grab it just like that. And so that grabs the tissue, and then we squeeze our handle right here. And as we squeeze it, we'll see that the needle comes up through the tissue, the rotator cuff tendon. And as it's doing so, you can see how it's pushing that stitch up through like that. And then as we start to release the handle, we'll see the needle come back down, and that leaves the stitch up like that, and then the trapdoor comes down and grabs the stitch, and that will hold it while we pull the instrument back out the shoulder, and then that will thread the stitch just like that. And so now you can see how we've got, let's get this off. And so now you can see how we've got another stitch that we can use for the repair, and then we can tie it down just like the first one. All right, so we've gone over how to actually tie the stitch. Now we're going to use a knotless technique, and this technique uses a different type of anchor where you actually don't have to tie any knots on the rotator cuff like over here. And so, but again, you have to use a different type of anchor, and this is one of those anchors right here. And so to demonstrate that, we just take a free stitch and we will load it up into our Scorpion device like this, and then we pass this through the tissue. So this is just one way we can do it. So we pass it through like that, and then we're ready to go get it. And so let's say we're going to come through our tissue right here, and then just like before, we'll pass that stitch up just like that. And then that'll grab the stitch and we can pull that out of the shoulder. And so that side of the stitch has been passed. And so now we can, got a couple options, but we can grab, so we'll come into the shoulder and we'll grab the other end of the stitch like this, and then we would put it on our device again, just like that. And so that's ready to go. And so now we've got the other end ready to pass. And so then we go back into the shoulder and we grab our tissue like this here. So that threads that up, and that grabbed it just like before. And then now we can pull that stitch through. And so what that does is it creates this inverted type of what we call a mattress stitch. And that's got a good, nice secure hold on the tendon tissue like that. And so we can use that to pull the tendon down and repair. But as you can see, there's no anchor here. But we're going to use this knotless device. So just like before, we will prepare a socket for the anchor. And so I've kind of started that here. But we're going to tap that into the bone. And so I'm going to hold this down once again, and we'll get this tapped down. Just take a few more hits here. Okay. All right, so now that's made the socket here. And then we just remove that. Just like that. And so we can see, if we zoom in a little bit, we got a nice pilot hole for our anchor. And so we're going to come back over to this green anchor here, and we need to pay attention to this part of the anchor right here. And so this little area, this eyelet, is what we will pass those two stitches through. And some of these anchors come in with different little things, but this one has this device right here that makes it easy. So we grab our two stitches that we just passed through that right there. And then all we got to do is pass it through this eyelet. So I'm just evening up the ends of my stitches here. And so we'll come to our anchor just like that. And then this just goes through here. There we go. And so now we should be able to pass these two stitches through the eyelet of this knotless anchor. So that goes through just like that. Okay, so now you can see how on this anchor we've got these two stitches that we're loading in like that. And so now all we got to do is we pull these stitches tight like that, and you can see how now the anchor, as we push it into bone, will start to tighten up our repair. I'll zoom in a little bit so you can see. And so now the anchor goes in, and then we often have to tap this in, so I'll try to do this one-handed. Little light adjustment. And so we tap this anchor into bone, just a couple taps, hopefully more. Okay, so there's how that anchor goes in, just like that. So that's ready to go in. And then this will be a little tricky because you kind of have to have two hands here. And then what we do is we tighten this anchor in just like that. almost all the way down. Again, this is kind of a two-handed thing. I'm trying to do one-handed, but that's how that works. So that tightens up just like that. And then we will detach the anchor. There we go. There's a little cleat on the end here, so we remove this stitch that comes with it. Sometimes we use it, sometimes we don't. And then this will pop out. If we don't want to use this stitch, we don't have to. That comes out, and then now you can see how we've been able to secure the rotator cuff with an anchor without tying knots. And then you just cut these two stitches right here. I don't have a knot cutter or suture cutter with me today, but that's how that works without a knot. So it gives a really nice low profile type of repair. And then of course on the other side we've got a knotted repair where the knot is holding things down snugly as well. And then you have this type of repair as well. And you can use different types of combinations to come up with these elaborate type of repairs to repair an entire a big rotator cuff tear. All right, so we will demonstrate more of a complicated repair on this side of the model. I've already made a couple pilot holes for the rotator cuff anchor using our awl as before, and so just like before, we will mallet that in and create our pilot hole so our suture anchors can go in. It just goes in just like that and then creates those two holes. And so we'll thread our anchors in just like this. That'll thread into the bone. Just like that. And then just like before, we will pull the anchor out, or pull the handle off, I should say. And so that will come out just like that. There's a little bit of a give on that part. And then we'll do a second anchor right here. Just like that. That will thread in the bone. So now we've got two anchors because let's just say we want to repair a bigger portion of this rotator cuff. And so we will, like we did before, we're going to uncleat all these stitches off of here. There we go. All right, so that's ready to come out. And so now we can pull the the handle away from the body, just like that. And so now we've got, keep these old stitches out the way. So now we've got two anchors ready to go to repair a bigger part of this rotator cuff. All right, so we're going to repair a big surface area here. So we've already passed our anchors, and so we're going to do a little bit of a combined type of configuration. And so just to make things easy, we're going to use this scorpion device. And so we'll pass one of our blue stitches like this, and then that will come out like that. And then we will grab the other side of the blue of the blue stitch. We'll load that up just like that, and then we will grab a little bit further over like this, and then that will come up and deploy like that. All right, so now we've got two stitches through there, and so we're going to come over here on this anchor, and then we'll do something similar with the striped suture. All right, so then we'll come in with our device, our scorpion device. You can use any device you want to pass the stitches. And so you can come up just like that. And so that will deploy that stitch. And then, as you might imagine, it gets tricky keeping all these stitches from getting tangled, but with practice, it can be done pretty easily. And so then you come in, we'll come in right here, and then we'll pass this last limb of the stripe stitch, just like that. Okay, so now we've got all of our sutures passed for this part of the rotator cuff here. All right, so we're going to finish up our repair. So we've passed the two stitches, the blue and the stripe, through this part of the tendon. I cut these other stitches to get them out of the way so they weren't distracting. We don't actually need these white ones, so we're going to go ahead and pull those out. And we will go ahead and tie these two stitches like this. And so we call that, this is more, we call this a medial row, and this is lateral. So medial meaning more inside the shoulder, and lateral towards the outside of the shoulder. And so we can go ahead and tie this just like we've done before. Get this through here. All right, so we have our sliding knot, just like that. And then we will slide our knot down, and that really snugs that down nicely. We will get our knot pusher, and we can push this part of the rotator cuff down just like that. So that snugs that down really well. And then we just want to get it tied down really nice. So that's that. So we'll leave that. We won't do the other, well, I'll tell you what, we'll do one more throw just to make sure it doesn't come loose. But in real life, we'll typically put a few more throws just to make sure everything's really secure. There we go. Okay, so that part's tied, but we won't cut those yet. And then we'll do the same thing for this part of our tear. And so we'll slide that back so we can do our sliding knot, and then we'll tie the exact same knot. Just like that, oops, just like that. And we'll pass that through. Pass that through like so. Again, I'm trying not to move our model as I do this. And then now we should be ready to get our sliding knot ready. So there it is, coming together. There we go. Okay, so now we're ready to slide this part down. So just like we've done before, that slides right down, and that really secures the rotator cuff tear like that. All right, so time for the suture passer or pusher. This comes down, and we can really secure that down like that. And then we pull both ends to really get it snugged. And then one more throw for this demonstration. And then we use our knot pusher to come down and snug that up just like that. There we go. All right, so now we've got this medial row. We've got this medial row repaired, and you can see how that really, like I can't even lift that up right there. So that's really secured that down really nicely. But we still have this flap of tissue on this side, so what can we do about that? And so now we can use these stitches that we left tied to do a knotless technique. So this is kind of like a combined knotted and a knotless technique. And so we will, so we've got our two special anchors here, and we'll tap in our pilot holes for those anchors. Okay, so returning to the model, I went ahead and made the pilot holes for this second row of anchors, just like before, with the awl going in just like that. And now what we will do is we're going to use the knotless function of these anchors to really snug down this last little part of the tendon so it's not flopping up like that. And so we will put our device like that. And then what we'll do is we'll pick one stitch from each side. So we'll get this one blue and we'll get this one striped, and then we can pull this over like that to compress it down. So we'll get one stitch from each anchor. So we got a stripe and a blue, one from each anchor, and that goes through just like that. And then once we get it through like so, we can pull it and deploy it through the anchor like that. And so now we can secure this part of the tear down just like this. And so again, trying to do this one-handed. And so as we push that anchor into bone just like that, like I mentioned before, sometimes we got to tap it, so let me grab my mallet. All right, so now you can see how our anchor has pulled those two stitches in through there just like that. And so I'm going to try to get this to screw in while holding our model just like that. Hang on one second, there we go. Okay, so we're going to screw that in. There we are. You can really feel it squeaking because it bites so well. Okay, so that's the first one, and so we'll get our anchor off just like that, and then we can pull this back, and then there we go. So we don't need this extra stitch. They throw that in there for us in case we need it. And then now you can see how using this knotless technique, we've been able to pull this stitch over like that, and these two will compress that outer side of the tendon. And so now we just got to do the other side. So we'll get another anchor, just like we had before, and we will pass our stitches through here like this. So we'll get one stitch from each anchor, evening them up a little bit so we can pass them through. All right, so that looks like that's ready to go. And then we pull it through just like that. And then we will just get everything evened up. And so now we can deploy this last anchor into the socket just like that. All right, so we just slide that in, just like that there. And you can actually pull on these a little bit just to cinch it down just a little bit more, perhaps a tap. There we go. And then now we just have to tighten this all up. Let's see if I can, there we go. All right, so I'm gonna have to hold it just like that before. Okay, so we're gonna tighten this on in. Again, this is a two-handed operation. I'm holding my model still while I do this. There we go. Okay, so that's really snugged in just like that. And we can slide the anchor out. There we go. We take off the bonus stitch, and then we can cut the excess stitches just like that. And so there's and then there's a more of a complicated construct that we can use to repair bigger tears. And so kind of showing you what we were talking about earlier, you see now this flap, this edge is really snug down, so it's repaired over this big surface area. And if we had a big tear, we would add more anchors and more stitches to get this last little bit down during a real surgery. But this just kind of demonstrates a more complicated type of repair compared to maybe more simple types of repair. When it comes to comparing different types of suture configurations and how many anchors to use, there's lots of good ways to repair the rotator cuff, and all these different techniques have been shown to be pretty much equal in outcome in terms of healing and strength and things like that. So, so hopefully watching this video, you've gotten a good idea of what it looks like to repair a rotator cuff, get a general sense of how we deploy anchors, and really how we do things in the operating room.